So LDN is not like any other medication ever taken. There's a cascade effect, like you take it and you have that huge downstream effect. It uses the body's own system, the endorphins, and one of the big receptors that causes a lot of good things to happen is this TLR4 receptor, the toll-like receptor number 4, and that really, it's shaped like an X where the endorphin fits on the top, and one arm upregulates the immune system, the other arm upregulates the body's own anti-inflammatory system. So imagine if you need the endorphin to fit in on the top of the X, but you as a immune dysfunction patient only have 75% of your normal level of endorphins, how could your body go and activate this? So it needs its full level. Again, it's extremely important for people to realize that the expectation can be anywhere from 1 week to 6 months, and we can't always, explain why. Can't explain why. That's just the way it is. And the side effects really are minimal. The most common side effect is the dreams. People remember their dreams. Now, I wrote some of this, I just say I changed the way I dose. So I used to dose at higher doses and quicker. I used to get to 4.5 milligrams in 3 to 4 weeks. Now I go much slower, 0.5 milligrams, and I only move once a week by 0.5 milligrams. It takes 2 months to get to 4.5 milligrams. And since I've done that, my patients have had no issues with anxiety, no issues with no GI issues. In like 2 years, the only thing I've had besides patients remembering their dreams is one patient had a headache, and even though we lowered it all the way down to like a puff of air, like I think 25 micrograms, they still had a headache. So, but that's one patient. Everybody else, no problems, except for remembering their dreams. So 90% of my patients take it at night, and 10% of the patients who just don't like their dreams take it in the morning. But most of my patients, they're like, either they're sort of neutral about it, or like, hey, it's like the 60s or the 70s. It's like kind of cool again. They're all happy. It's like, whoa, they like it again. It's funny. Some people actually just dream colors, and some people dream like they're watching movies. It's just interesting what the patients say what their dreams are. Onset, dose, and titration are important for minimizing side effects and ultimate success. The reason I say that, if you remember what I said before, that patients can sometimes have a lower dose that they hit, and that success, and then they go a little bit higher and they feel worse. If your markers are 1.5, 3, and 4.5, but what happens if your success is at 2.5 and you just overshot, you went straight from 1.5 to 3, you're not going to hit your success number. So you low and slow and take your time. That's the way to go with this medication.